morning, good afternoon, good evening, wherever you are. Yep, we're at Leighton Mills car park at the posh end. Yeah. This is probably the last one on cesium chloride. You really need to do your own research into this because it's pretty hot. Right, before you try anything with this, see a doctor or health professional, practitioner even. Now, you'll need cesium chloride, potassium supplement, zinc supplement. You've also got to take a detox therapy. Now, the detox therapy is to get rid of the dead and the toxins that the bacteria like cancer or anything like that leave behind. If you can't get rid of them, you're in for a rough time. Now, it's been proven to get into calcium cells. The cesium, and maybe that's also rubidium because that's in the same class. One makes the cancer cells alkaline. Note, the blood is not made alkaline, only the inside of the cancer cells. They don't pick on normal cells. 2, limits the intake of glucose into the cell, thus starving the cell and making the cell sick from lack of food. 3, neutralizes the lactic acid, which is actually what causes the cell to multiply uncontrollably. 4, stops the fermentation process, which is a second effect of limiting the glucose. Hans A. Nijper, MD, 28 to 98. That's 1928 to 1988. 98. Went to Germany to be treated by Dr. Nijper, including one of the presidents of the United States. It works by making the cells highly alkaline, typically 8 and above, thus killing the cancer cells. Yeah, that sounds reasonable. If they're acid, then alkaline would make them ill. It not only kills the cancer cells directly or indirectly, it immediately stops the metastasis of the cancer. It can start shrinking tumour masses within weeks, and almost always stops the pain of cancer within 24 to 48 hours, depending on what is causing the pain. But don't forget, 0.5 gram encourages the growth of cancers and tumours because that raises it to the perfect level, so it's got to be above 0.5 grams. Now, no, it is the cancer cells, not the blood serum, that rises to 8 or above. The body keeps the blood serum around 7.4. Now, it directly targets cancer cells. Normal cells don't ingest the cesium chloride. Now, DMSO allows cesium chloride to target the cancer cells in an even more dramatic way. Now we've got links and stuff to this video, and when the website's ready, they'll all be there, and you can that is a good place for you to start your research. Now, after the mix together, wait several minutes before you apply it to the skin. Now, this is on a tumour. Don't mix the potassium in with this mixture. The potassium should be given no less than 1 hour after cesium chloride. You can use a spray bottle or eyedropper bottle to administer liquid to the skin. Spread the mixture over a wide area of the skin, or you might get a rash. While DMSO, it's non-toxic, it can be mildly dangerous to handle. So it's critical to read the warnings about DMSO, and I can vouch for that. It is brilliant stuff. Now, about body odour and DMSO. 1 tablespoon of DMSO, i.e. 2 a day, will cause significant body odour. It's been described as an oyster or garlic smell. The bad breath an odour caused by the DMSO leaving your body after doing its job. So it's worked. Normally it leaves via the kidneys, but sometimes it leaves through the skin. You may take a shower and change your clothes more than once a day, but it is absolutely critical to treatment because it grabs hold of the cesium chloride and drives it through the skin and into the cancer cells. Now, for brain cancer patient, it blasts past the blood-brain barrier like it wasn't there. Mind you, some cancer patients would rather die than have that much body odour. For advanced patients, that may explain their options. What not to take with cesium chloride? Now, the doses you're going to get in a minute are designed to maximise the safe number of cancer cells that can be killed when treating cancer at home. Now note that, the safe number of cancer cells that can be killed while treating it at home. No alternative cancer treatment should be used with a cesium and DMSO treatment, especially ones that kill cancer cells. Killing too many cells by combining treatments may lead to too much debris, i.e. dead cancer cells and any toxins they produce while or before they die. Now you can add to the treatments to build nutrition, build immunity system, protect the kidneys and liver, etc. The pattern of taking it is every day until you reach a cesium limit. Now, it's important to note with the cesium chloride treatment, tumours may actually become enlarged before they start to shrink. That's generally inflammation. And inflammation is not to be worried about. DMSO will prevent that quite easily. Additional warnings. The patient should continue to take potassium for another 3 months. The reason for this is the cesium will stay in your blood and continue to pull potassium into the cancer cells and out of the blood serum for about 3 months after you stop taking it. Now that's pretty good. Now if you don't know where to get your potassium, a simple way is to nip with a pair of scissors the end off a banana, each end, cut it in half, boil it in water for a few minutes, let the water cool and drink it. Yeah. Now if it's in your digestive tract, or your digestive tract is obstructed, don't take it, don't use the treatment. The inflammation from this treatment and inflammation added to the obstructed digestive tract can be very dangerous. Now, this will be the last bit on cesium chloride. We go back to something modern. Right, here it is. 3 grams cesium chloride divided in 2 equal doses. That's 1.5 grams each. Take 1200 ml of liquid ionic potassium chloride a day, divided into 2 equal doses. Note the potassium is half of that of cesium chloride and measured in milligrams. Take the potassium dose at least an hour after the cesium chloride. Now the reason this is if you're taking it at the same time, potassium can block, i.e. compete with the cesium chloride from getting into the cells. Potassium should be taken orally. And you don't want 2 things competing because it don't work. Now several foods should be high in potassium that you eat every day. Now you can do research on that. Bananas boiled is pretty good. Drink the water. Now you've got to drink a lot of water with this, maybe more than half a gallon of water a day if you're over 125 pounds in weight. Now here comes a kicker. Don't do the calculations on your own. Have 2 people to calculate how many teaspoons or tablespoons of cesium, chloride and potassium you take for each dose. Many people don't use the calculations wrong, don't use the calculations right, and take the wrong doses. Always have a second pair of eyes to make sure your calculations are right and you're taking the right dose. If you don't know anybody, don't take it. And don't forget, this is for your education and a start of your research. Now some of the vendors recommend 3000 ml liquid ionic potassium chloride per day. They don't mention about having an hour gap between taking the cesium and the potassium. They may also have a person take the cesium chloride in a cycle for 5 days on and 2 off. But on testing of people doing this, it's not as effective as using the above measure. DMSO is always required when you take cesium chloride. It's important now to understand how to take them together. Now the DMSO you want is 99.9% pure. That's the only DMSO I've got. Now you want it mixed, 70% DMSO and 30% distilled water or aloe vera juice. Mix the DMSO and the cesium chloride together. The dosage of DMSO is 1 tablespoon each time you take the tablespoon of cesium chloride. DMSO is 100% natural and non-toxic. And that is the end of cesium chloride. Now don't forget to do your own research. If you don't do it. Don't listen to anybody that tells you this stuff, including me, without checking the facts. Okay? See you tomorrow.